Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and try to make a system that works better for all of us. Before I get started, we're going to be talking about private equity. Before we get started, I want to point out that down below in the YouTube description box is a link to the Healthcare Advocacy newsletter. That is the text for today's video. It has all the background material and references and actions and contact information. If you need to figure out what to do with a claim that's denied, there's information there. If you need to get an abortion, there's information in there. Anyway, so let's get started. Healthcare held hostage to private equity. That's the title. If a friend of yours was in trouble, you'd pretty much do whatever you could to help them. Those of us who do not have empathy deficit disorder do that. We help others because we have empathy for their pain. Now, Senator Markey of Maine has empathy for others, and he's doing just that. He's helping others. He is a member of the U.S. Senate Health, Education, Labor, and Pensions Committee, HELP, and he held hearings this week in Boston on how for-profit ventures are negatively affecting healthcare. I have a link to a description of those hearings. Recent studies have found that the quality of patient care in hospitals and nursing homes goes down when private equity enters the picture. Patients have a right to know who owns their healthcare provider, especially if the owners really don't care much about their health. Communities are often left to pick up the pieces after private equity has stripped local hospitals and other facilities of resources, leaving them struggling to keep their doors open and provide care that families depend on. The failures of Steward Health in Massachusetts, formerly owned by the private equity firm Cerberus Capital, look at that, and Prospect Medical in Rhode Island and Pennsylvania, owned by the private equity firm Leonard Green, show that legislation is urgently needed to give the government the tools to hold private equity firms and other bad for-profit actors accountable for looting the healthcare providers and weakening America's healthcare system. That was from Senator Markey's page. Recent studies have shown that nursing homes that become owned by private equity have a 10% increase in death rate, comparing before the purchase and after the purchase. And something else they do that I find particularly nefarious. They cut back on staff to save money, and then they over-sedate the patients so it doesn't take very many people to look after them. This is really nasty. I mean, this is not what anybody wanted for grandma. Okay, hospital adverse effects, when they're purchased by private equity operations, increase by 25%. That's falls, infections, all kinds of things like that. You can find links to those studies, because they're not making this stuff up, in a previous healthcare advocacy newsletter I wrote, and there's a link to it down below in the newsletter. Now, Senator Markey has drafted legislation to address this problem. It is called the Health Over Wealth Act. It incorporates transparency portions of the bill H.R. 1754, the Healthcare Ownership Transparency Act, that Pramila Jayapal put forward last year. This bill does more because it forces corporations to protect the public by setting aside funds to protect the facility that they've purchased from failure for 5 years. They have to keep that money in escrow. I have a link to the summary of the proposed legislation and a link to the actual text so far. Now let me point some things out for you, just summarizing the bill. It requires transparency of ownership of healthcare entities, including debt, income from fees, sales, leasebacks of properties, health quality statistics, a whole bunch of things. There should be risk mitigation for private equity owned facilities that would include establishing, as I mentioned, an escrow account to cover 5 years of operating expenses in the event of failure. There should be access and maintenance of services, public notification and community input prior to hospital closures or service reductions. This requires hospitals that receive Medicare payments to notify the Secretary of Health and Human Services at least 6 months prior to the discontinuation of services, or if there's going to be a hospital closure. There are also enforcement mechanisms and serious fines for noncompliance with the reporting responsibilities. It's actually pretty good. Go read it. Anyway, here's an action that we can all take, and it's due by May 3rd of 2024. Senator Markey wants to hear from everybody about his draft bill, and we can submit comments to healthoverwealth@markey.senate.gov. I have a link there, and if you click on the link in the newsletter, or I'll put it in the YouTube description box, what it should do is open up your email software and prepare an email for you to send. If that doesn't work, just open up email, and the address is healthoverwealth@markey.senate.gov. And you can just send him an email. He needs to hear by May 3rd. Any suggestions you have or improvements to the bill, he wants to know from all over the country. Now, if you like the bill, he and his staff would appreciate a note saying so. So you can just shoot him an email and tell him good job. All right, let's talk about contraception news. Opill. CVS Caremark, the pharmacy benefit management subsidiary of CVS Health, is going to add Perrigo's birth control pill to its preventive services oral contraceptives list and make it available at no cost for lots of plan sponsors, according to a pharmacy update on March 28th. The US FDA in July approved the over-the-counter use of Perrigo's drug Opill, making it the first oral contraceptive in the country that can be purchased without a prescription. Let's talk about empathy treatment, especially as it applies to maternal care. As the U.S. grapples with a maternal health crisis, and we've talked about this over and over again, that the way women are treated in healthcare is not good, and that the maternal and infant death rates in this country far exceed what our peer industrialized nations have. And it's mostly because everybody there has access to health care. I know the other day we did an article about one state that has an abortion ban, and most miscarriages, I don't know if you're familiar with this, but most miscarriages occur in the first 12 weeks or so. And so doctors don't want to see women. They're choosing not to see them if they're less than 12 weeks pregnant. So they're actually denying care, because if a miscarriage occurs, they don't want to be accused of having of fostering an abortion and then having to go to prison. Can you imagine? Anyway, this is slightly different. The U.S. is grappling with a maternal health care crisis. A new study shows that more than 1 out of 8 new mothers are shouted at, scolded, or ignored by a healthcare provider during delivery. The study was published in the Journal of the American Medical Association Network Open this past week. Actually, it was yesterday, April 4th. And it used data from the 2020 Postpartum Assessment of Health Survey, which was a large-scale data collection effort on the health and well-being of postpartum people conducted at Columbia University. And there are links to both the Journal of the American Medical Association report and the data collection at Columbia University in the newsletter. The experiences of 4,458 postpartum people were used for the study. Out of the survey respondents, about 13% reported being mistreated in some way during delivery. The study results parallel findings from the Center for Disease Control and Prevention, published last year on the mistreatment of expecting mothers during their pregnancies. That data found that 1 in 5 expecting mothers experiences mistreatment during pregnancy, and that those moms are more likely, get this, of course, to be Black or Hispanic. Who said there's not a problem? Anyway, most cultures, let's be honest here, most cultures take care of pregnant people, and they take care of new moms, and they go to great lengths to do it. What the hell is wrong here? Where's the empathy training? The system is just backwards. That's what it is. Anyway, if you know someone who's a doctor or you want improved empathy training, I actually include a link in the newsletter to empathy training that I believe is offered by the Massachusetts Medical Society. I didn't see a cost on there, and they had 3 separate classes, and if you're a doctor or a nurse, it qualifies for continuing medical education credits. Anyway, that's what I've got for you for today. Down below, you can like, share, and subscribe. Please do that. You can also subscribe to the Healthcare Advocacy newsletter for free, and you can send me comments or requests for research, and you can also do that at healthcareadvocacy1@gmail.com. That's it. Have a good weekend.